Hello and welcome to Health Options with me, Rabi Abdullah. Key players in the battle against COVID-19 in Nigeria have expressed worries about an escalation in the level of non-compliance with the safety protocols of social distancing, wearing of face masks in public places, sanitation and hygiene, especially in markets, motor parks and some places of worship. Findings have shown that a lot of people are still in denial and disbelief about the existence or the reality of coronavirus. I doubt if you will still remain with the bandwagon of those with such wrong perception by the time you watch the package our correspondent who got embedded right inside one of the isolation centers in Kano brought back. Two major factors have been attributed to the astronomical increase in Nigeria's COVID-19 infection rate. The fact that the nation is at the community transmission stage of the disease, while the other is the increasing pace of testing. Of great significance, however, is the need to channel whatever is required to keep the fatalities, that is, the death rate from COVID-19, as low as possible. That's why those who test positive for the disease are advised to go to a treatment center. Persons with underlying ailments such as diabetes, hypertension, cancer, HIV, tuberculosis, asthma and others, or those above 60 years of age are strongly advised upon testing positive for coronavirus to get to a treatment center as quickly as possible. This is because studies have shown that the symptoms for coronavirus can start mildly with slight fever, cough, loss of sense of smell or taste, but can suddenly escalate to shortness of breath in no time when it is difficult to get to a hospital on time. On the policy track of this episode of Health Options, we shall take a look at current happenings around the nation's response to the coronavirus pandemic with coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu, as my guest. This is surely an episode of Health Options you can't afford to miss. Many thanks for joining us. This is Health Options, the program that not only tracks government policies on health, but helps you to make informed choices about your health. We're taking a look at current happenings around Nigeria's response to COVID-19. And with me in the studio to take us through the discussion is the coordinator of the Presidential Task Force on COVID-19, Dr. Sani Aliyu. Thanks for coming on Health Options, Dr. Sani Aliyu.
Thank you for having me, Rabi.
Okay, we are at the stage of community transmission, and we've even identified local governments, up to 20 local governments that have the highest prevalence rate. I'm aware of Lagos mainland topping the list, and AMAC and the FCT following closely. Let's start from there. What are those new strategies that the nation is deploying in that regard?
So you're quite right. The virus has already escaped into the community, sadly. But this is something that we have always anticipated. If you look at the trend in the disease condition throughout the world, very few countries have been able to keep the transmission at bay. And this is why it's important more than at any other time for people to come together and have a common approach. When it comes to the high burden local government areas, of which there are about 20 or so, they contribute about 60% of the overall burden of COVID infection. And most of these local government areas are in urban areas. They are mostly slums or overcrowded spaces where it's very difficult for people to maintain social distancing. We now have a raft of measures that we are developing together with the state governments and our partners, looking at a variety of strategies, all linked to controlling the transmission, stopping the transmission. So, for instance, in Kano, they've started doing house-to-house screening and testing of persons, pushing the number of tests that we are doing in these areas, trying to look at issues around compliance, the wearing of masks, for instance, pushing through risk communication and community engagement strategies. So in these local governments, we've been working closely with the National Orientation Agency and some of the communication outlets to provide information to people on what they are supposed to do. And it is particularly important when it comes to the vulnerable, especially those above the age of 65 that live within these areas, to be aware of those risks and stay at home. We are looking at the possibility of doing what we call precision lockdowns of these areas, but it will not be easy. It's not something that we will start straight away because the boundaries for the local governments is quite blurred. You can imagine if you go to Kano and you want to just close a certain local government in Kano, there are houses that are already on the boundary that go from one local government to another. So it's not really that easy. But to me, at the stage we are, what will really stop transmission is if the communities come together and make sure that they follow the guidelines that we have imposed, that we have recommended.
Okay, that's talking about taking personal and collective responsibility
Absolutely.
to entrench survival now. So much messages of, have gone out there, and in spite of all that, some people still let down their guards, and you begin to wonder. Because someone had even suggested that we should start using shock messages. For instance, citing instances which those hide their traits in some countries, the devastating effects this virus had on some countries, even though we're lucky that, we could say our own rates, has been slow to some extent compared to what is happening in other climes. The task force looking at that direction.
So we are pushing through a lot of messages. Of course, as you know, behavioral change is not an easy thing, especially if you are asking people to change the way they socialize, because humans are social animals. Imagine, none of us would like to be in a room locked up for a prolonged period of time. Yeah. None of us would like to stay alone without talking to somebody. It's part of humanity to be able to relate, to interact, and to have a good time. And it's those processes, those activities that we are saying to people, please stop. Please stop interacting with your neighbors. Please stop going out to socialize. Please don't go to places of worship where there's a lot of mass gatherings, etc. They are not easy messages. To the contrary, they are very difficult. If you compare it with other infections like HIV, for instance, where the message is pretty clear, do not practice unsafe sex. So that's a different issue altogether, and a lot of people can identify with that, and they know the risks, etc., and they may follow it. But if you ask somebody who is at home, has to go out for a living, and you ask him stay at home because of these issues, if the person does not have money, he has no option, he has to go out. And in the same way, if it's a taxi driver who wants to make a living, and you ask the taxi driver, don't take anybody who doesn't have a face mask into your taxi, the likelihood is if he knows that he can get away with it and there's no law enforcement, he probably would, because he needs that money. So a lot of it is about perception risk. The moment we know that we are at risk of a life-threatening illness, and that's where your shock therapy, of course, may come in. But then COVID, in as much as we have a lot of people with COVID, it is still not as widespread as what other infections or illnesses like malaria, for instance, etc. There are people that can go for the whole 6 months without seeing a single person that they know who has had COVID. And apart from that, the symptoms of COVID are so non-specific sometimes that unless a person is tested, people can die of COVID without even the families realizing that they had COVID. Yes. Oh no, they had malaria. Oh no, they had pneumonia. We had a patient once when the hospital said it was just pneumonia, it wasn't COVID. But of course, COVID causes pneumonia. COVID causes a fever. COVID causes shortness of breath. So there are so many symptoms that people can easily be misled into thinking, well, actually he didn't die of COVID. It's only when others within the household start catching the same febrile illness that you start realizing that there's a problem.
Okay, let me take you back to this high burden local governments now. Do you have extra incentives that you're bringing to bear? Because I remember at the height of the polio virus, back then, it got to a stage where, at immunization days, you have, some other thing like, sweet and some other things, just to attract, parents to present their children for polio vaccination. Are you bringing anything?
You're quite right. In fact, one of the things we are working with our partners, and we should be having a meeting this week to conclude on it, is in the high burden areas, if we do widespread testing, anybody who is positive will be taken out and put into a community isolation center that we are trying to set up within these local governments. And any breadwinner or mother that's taken out of the family will be compensated. They will be given food, and they may also be given conditional cash transfer. We are working with our partners to see that through, so that in a way we alleviate their suffering while their breadwinner is out there being isolated. So those are the sort of things that we are looking at. Already there's a lot of palliatives that have been distributed across the country. In Kano, for instance, just a few days ago, we got some estimates about 1 million households who are reached with palliatives. And it's not just the federal government. We also have a lot of other voluntary NGOs, etc., that are actually putting money, and Dangote Foundation has. I know the First Lady's Family Assured have also distributed palliatives in Kano and other parts of the north. So already there's a lot going on, but what we need now is more sort of a more targeted approach. And these are the problem areas that we know. It's easier for us to put resources into those problem areas and put out the small fires than allow the small fires to build into one big, massive one and then trying to tackle it.
Okay, how much of the youth population are you, involving in the national response? Because I know that when we talk about asymptomatic patients, even for those spreading fake news about the virus, it's the youth population that indulge mostly in some of this.
Well, I don't know if I wouldn't want to get in trouble with the youth of this country.
Yeah, but that's the truth. It's a fact. I know what I'm talking about. So how are you involving them to make them have that, change of psyche, that they can utilize that energy, channel it into helping the national response?
It's a very good point. Almost half of the population of the country are below the age of 18. It's probably why we're not seeing such a severe presentation of COVID in a large number of people as you would have seen in Brazil. Brazil, for instance, we started having the same numbers some months ago, but now they've far surpassed us, and they've got a lot of mortalities, a lot of deaths from it. But you're quite right. Our risk communication pillar just over the last few days have met with representatives of the Youth Council. I understand they've also met with representatives of the Association of Local Government Chairman, or one of these bodies. Yes, Algon. Okay. And we have been working from the social media side. We've actually been quite active, reaching out to social influencers, or whatever they are called, to help us with the messaging. And we've also been identifying the key sort of fake news that has been going around and trying to address that, particularly at our daily press briefing. There's no doubt COVID is there. I think whoever denies COVID is actually doing a disservice to those that have died and their families, because it's almost like respecting people who have lost their loved ones. There's no doubt COVID exists. Yes, for a lot of people, they probably wouldn't come across it, but if you do, especially if you're above the age of 65, the risk of death is pretty high. The last time we checked, for those above the age of 60, 17% of them died. 17% mortality. So it's almost a 1 in 5. And I'm sure if for any disease condition, for anything that you say you have a 1 in 5 chance of dying, no way, you're not going to approach that problem, would you? You run away from it.
Definitely.
And that's why that message needs to be very clear. It's a pandemic. No pandemic lasts forever. It will come and pass. But our priority now is to remain alive. to try as much as we can to remain alive during this period and see the period through, see the epidemic through. And once it goes away, then we can resume our normal activities. But definitely post-COVID, this is the new normal. The new normal about wearing masks, the new normal about maintaining distancing, physical distancing, and also maintaining hand hygiene, etc. I'm sure there will be fallouts, but there will also be pluses. For instance, we've already observed a decrease in childhood diarrheas, for instance, because of the issue of hand washing. I'm sure you yourself, you probably would have noticed that maybe if you're having a cold every few weeks, you now don't have a cold. Why? Yeah. Why? Because we're wearing masks and we are gelling our hands, etc. The same measures that you do to protect yourself from COVID, it's also protecting you from other respiratory viral infections. When was the last time you saw somebody with a bad cold? If you did, you ran away.
You're right. You're right, because the slightest call for sneeze from anyone makes others jump for safety. So that takes us to the next question now, and it has to do with the treatment protocol. In the absence of vaccine, just recently I got information on the drug that the United Kingdom just discovered, and even went ahead to say that if they had gotten this much earlier, that their fatality rate wouldn't have been as high as it got. Can we borrow a leaf from
So generally scientists are cautious people, but when you see scientists being excited about a treatment, it means the difference between the two groups must have been really significant. Steroids, this is a drug called dexamethasone. It's a steroid. It's actually been around for a long time. There have been studies of steroid use in people with pneumonia, particularly those that are ventilated. We call it ventilator-associated pneumonia, etc. And what it does is it suppresses the immune system. Now you might say, well, if the immune system is suppressed and you have COVID, you are going to have more severe illness. But no, there's a cohort of people that when they get COVID, the way their body responds is the immune system goes into overdrive. We call it a cytokine storm. So the white cells just go berserk, and they start destroying, you start having collateral damage. They don't just destroy the cells that have the viruses within the lungs, but they also destroy a lot of lung tissue. We call it adult respiratory distress syndrome, ARDS. So in those situations, what you want to do is to dampen the inflammatory response, asking the immune system, calm down a bit, just destroy the virus, but calm down. And that's what steroids do. That's what dexamethasone does. And the good thing is it's available everywhere. It's not that expensive. So, but it's most effective in those that are ventilated, those that have really significant lung injury, because it dampens the immune response. It's probably not going to be as effective if it is used too early on, because you don't want to dampen an immune response that hasn't even started. You need to have some degree of immune response to get on top of the virus while preventing collateral damage that might occur. Okay.
Is there any projection you might want to share with us at this stage of the national response to COVID-19?
The most positive news I can give is if you take all the necessary measures we have advised, your likelihood of catching COVID will be low. If you make sure that you're wearing masks when you go out into the community, if you keep your hands clean, if you gel your hands frequently, if you maintain physical distancing. And the reason why we talk about physical distancing is even if I'm wearing a mask, like Rabi, you're not wearing a mask. If you cough at my face and I don't have these glasses, I could end up catching COVID.
That's if I have the virus.
Well, that is if you have the virus, but who knows? Hopefully you don't.
I don't think
Otherwise, I'll have to leave this program early.
I don't have the
virus. So that's the best bit of positive news I can give the public, that if you do follow the directives, the guidelines we give, we don't even need to lock down the country. But there's no doubt if we continue to have the sort of numbers we are seeing now, and people start dying, because the death rates that we have now reflect our numbers 3-4 weeks ago. There's usually a lag. COVID most times doesn't kill suddenly. It takes a few weeks, initially a bit of a cough, a fever, and then it doesn't go away, and then people deteriorate. So the deaths we are seeing now are probably people that have had it for about 2-3 weeks. So the numbers we are seeing now, we are not going to see that death rate, but God forbid we don't. But we may not see it until 2-3 weeks from now. So, but we need to be aware of the risk. We need to protect ourselves, and we need to protect the elderly, those the loved ones among us that we know have gone beyond the age of 60, those that have diabetes, hypertension, etc., those that have background illnesses. If you don't need to go out, please don't. Staying at home is much, much safer. But if you do need to go out, if you follow all the measures that we have advised, your likelihood of catching it will be much, much less.
We've had issues with hospitals turning back other patients with other ailments, and that has been an issue. And now we're at the verge of seeing doctors down-tooling. What does that mean to you?
I know the Federal Ministry of Health, through the Honourable Minister, and also Labour, have been working with the resident doctors. I think it's very unfortunate. I really don't think now is the time for doctors to go on strike. We are already in the midst of a pandemic. It's not right. People are already dying as a result of COVID. All hands need to be on deck.
Even though they said those attending, the frontliners attending to COVID-19 patients will not join in the strike. But of course there are other ailments that need to be
well, of course, what if I have diabetes and I go into diabetic coma? I mean, COVID is not the only thing that kills people. In fact, we know from what's been happening in Kano and other parts of the country that sometimes the increase in death rates is actually because people cannot access medical care. Hospitals are there for treatment, to look after patients. And I think now is not the right time to have a strike, and I really hope that our resident doctors come back and continue the good work that they are doing. This pandemic will resolve itself, but negotiations is what we need at this point. We don't want people to die unnecessarily. All
right. Thanks so much, Dr. Sani Aliyu, for coming on Health Options. We hope to see you again as we keep the nation posted on happenings from your task force.
Thank you, Rabi. Thank you for having me.
Are you one of those in denial about the reality of COVID-19? Let's now join correspondent Abdullahi Mustafa for the encounter he had with patients inside one of the isolation centers in Kano.
This is the Kwanar Dawaki Isolation Center here in Kano, and the state has 4 of such facilities already activated in various parts of the metropolis. But this one has 21-bed intensive care unit with fully equipped facilities, life-supporting facilities such as ventilators and oxygen concentrators. The Kwanar Dawaki Isolation Center is one of the 4 such facilities so far activated to handle COVID-19 cases in Kano State. Unlike the remaining 3, the facility has 21-bed intensive care unit for patients with severe symptoms. It therefore serves as a referral center for the COVID-19 response. NTA crew is privileged to be the first non-frontline health personnel to access the facility since its activation 2 months ago. This is the nurses station and the last point where any other person will stop and change his outfit. We are told we cannot enter the ward without wearing this, so this is what we are doing. We go inside to see the patients as we are done with this outfit change. Also, for us to enter the wards and take pictures, the consent of the patients had to be sought. The doctor has informed us that the client is ready and may likely talk to us, so we are going inside. Inside the wards are patients at various stages of recovery. This is another room in the intensive care unit of Kwanar Dawaki Isolation Facility where COVID-19 clients are being treated. And here we talk to one of them on the reality of this infection, the pandemic. Many people don't believe in its existence.
In my own case, I believe I attended a funeral, and I believe that is where I got it. I was very careful, but you know, you can't be too careful in a gathering.
Yes. This strengthened his belief in the reality and severity of the disease.
I encourage people to obey the social distancing and make sure that you don't encourage gatherings. people should make sure that they always wear their face mask.
While this patient is responding to treatment, others are still battling with severe symptoms, though in stable condition.
Now you see that maybe we're having about 3, if you have been following the number of cases in Kano, so of course that's also telling on the number of admissions we are having in the hospital presently.
Soon after leaving the isolation wards, we were directed to the area where we are to doff the personal protective equipment worn at entry point. Indeed, wearing and doffing aren't very easy.
Non-compliance with the safety protocols of hand hygiene, practicing of social and physical distancing, wearing of face masks put you and your loved ones at the risk of COVID-19. A quick reminder that you can go to our YouTube channel to watch the upload of these and other episodes of the program. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Many thanks for watching. It's bye for now.